G'day guys, it's Dr. Rob from Dental Society, and I wanted to talk to you guys about something called Guided Biofilm Therapy, or GBT for short. Now, before we talk about GBT, it's important to understand the difference between calculus and tartar and biofilm. Now, if you haven't had a clean in a little while, if you have a look behind your lower front teeth, you might find you've got a chalky white or brown or black residue right along the gum line, sort of following the gum line and covering a little bit of the teeth. Now that is calculus and tartar buildup, which is essentially a hardened plaque, which you can't get off with a toothbrush anymore. And that's why we sort of suggest every 6 months you come in for a good scaling clean. Now, calculus and tartar is very easy to find. It's very easy to feel along the root surfaces of the teeth with certain instruments, and we can target it and get it off quite effectively. Now, biofilm, on the other hand, is a very, very thin layer of bacteria which coats pretty much all the surfaces of the teeth, as well as the soft tissue and the surface of the tongue. Now, it is also really, really important to get this biofilm off. Now, dentists and hygienists and therapists have been cleaning your teeth the exact same way for decades, and there is absolutely nothing wrong with that. That is the standard. It is the World Health Organization standard, and it's generally using an ultrasonic scaler, which is a vibrating tip, and some pointed instruments, and it does a good job. It's fine. Biofilm, on the other hand, is quite difficult to remove with those instruments, particularly when we can't see it. But now, with guided biofilm therapy, what that is we use a dye. So it can be a pink or a blue or a purple dye over the teeth, and it will literally stick to the biofilm and show us where that bacteria is. Now, surprisingly, I had my teeth cleaned about a month ago with Hannah, and prior to me going into that appointment, I brushed my teeth, and I let's say I did a very vigorous job on brushing. I wanted to present my best self to Hannah, even though I was about to get my teeth cleaned. It makes no sense, but it made me feel better. But anyway, once I was in that appointment and she disclosed my teeth, that means putting the dye on it, and I rinsed that out. Having a look in the mirror was a little bit confronting. I mean, the amount of biofilm and bacteria that I had missed, or that would adhere to my teeth a little bit stronger, was phenomenal. And so the importance of guided biofilm therapy really came to light for me. And it's something that we are going to be doing regularly and incorporating it as a standard in your scale and cleans. Now, this brings me to my next point. Now that we are using GBT and we can locate this biofilm, there needs to be a better way to clean it off. So using our pointed instruments, they're very specific. So cleaning off large surface areas, a little bit hard to do. Very similar to, let's say, cleaning your driveway with a metal brush as opposed to a pressure washer. So what we have now, we have some new technology called from EMS called an Airflow. Now, an Airflow uses very, very fine particles under pressure with water that is warmed to 40 degrees. So it is really, really, really comfortable. The patients that have had the EMS and the Airflow used on their teeth for their clean have absolutely raved about it. I too, complete advocate. Really don't feel like there's a lot going on in there at all. So it's really, really comfortable, but it does cover a large surface area of the teeth, and it is really, really effective of cleaning off that biofilm. Now, I mean, why do we want to be so engaged at removing all this biofilm? Well, study after study has shown that there are causative links to certain systemic health issues, such as cardiac disease, stroke, we've got Alzheimer's, even preterm birth defects in pregnant women. And that's only some of them. There is quite a big array. Even the World Health Organization now recently released an article that is suggesting to revisit the way that dentists maintain oral health for their patients, which I think is really, really important. I think we do need to upgrade. We've been doing it the same way for too long, and there is better, especially now.